Hello everyone again. I'm Dr. Nahla Hamouda, lecturer of clinical pharmacology in the College of Pharmacy, Rizmikan University. Today, I'm going to talk about the pharmacology or pharmacotherapy in pregnancy, part 2. Please, if you haven't listened to part 1, please listen to it. So, let's start. Again, I want to remind you about asking your patient before describing any drug. Are you pregnant or expecting pregnancy, or are you a lactating mother? Again, I want to stress that you should ask your female patient this question. Please don't be shy to ask about that. If you prescribed a wrong drug that is affecting the development and growth of the baby, that woman will have unhealthy, diseased baby for all his life. So please always ask the patient if she is pregnant or not, or if she is breastfeeding her baby or not. So, in pharmacology in pregnancy number 1, we discussed about the teratogenic agent. So now we want to explain what is a teratogen. A teratogen is any agent, whether a drug or food or any other agent, that results in structural or functional abnormalities in the fetus. It means after delivery, this baby will forever have a defect in the body organs, either physically or physiologically. It means they cannot function very well. Or in the child after birth as a consequence of maternal exposure during pregnancy. That's why growing or giving any drug during pregnancy can affect the child for all his life. What is teratogenicity, or what is a teratogenic drug? It is the ability of any drug to cause any fetal abnormalities when given to a pregnant mother. So, teratogenic drugs are the drugs which, when given to a pregnant female, the baby will have teratogenic effect, structural or functional disability for all his life. Drugs can affect the fetus in 3 stages. The stage of fertilization or implantation, it's the first 2 weeks after the ova and sperm meet together and combine and make a bigger fetus. This is the first 2 weeks of conception. Or at the stage of organogenesis, organo means organ, genesis means formation or synthesis of organs. It's basically from the 2nd week of pregnancy till the 12th week, where all the organs in the baby's body are formed. Can you imagine? This stage is very dangerous if the mother takes any teratogenic drugs. The formed organs will be defective for life. And the 3rd stage is the state of growth and development. It means all the organs have been fully synthesized or formed, and then it takes time for them just to grow up till the full-term baby at the age of 38 to 40 weeks of pregnancy. The stages of fetal development and the effect of teratogenic drugs. As I just mentioned, the first trimester is the first 3 months of pregnancy, and we can divide it into 2 phases. The prenatal phase, which is the first 2 weeks of gestation, as you can see, sends the unit of the ova and sperm to make one bunch of cells. If a teratogenic drug is given to the mother during the first 2 weeks, we can have a prenatal death. What is the meaning of prenatal death? The mother loses her pregnancy. Simply, this bunch of cells will be dying and it will be lost. So the mother loses her pregnancy. This is the first effect. If the mother takes a drug, teratogenic drug, from the 2nd to the 12th week of gestation, it's the period where all organs are formed. So if she takes a teratogenic drug, the baby will get a major morphologic abnormalities. It means the body shape will be 100% different, and also the function will be different. If the mother takes a teratogenic drug during the second or third trimester, the baby will have a physiologic defect and minor morphological abnormalities. Minor means it's not very serious, but major means it's very serious, changing the shape of the baby. But in the second and third trimester, the drug will affect the growth of the baby. So maybe we get a smaller baby than normal, not full-term baby. Maybe she delivered before full term or before 38 weeks of pregnancy. So if we have a teratogenic agent between the second and 8th week, it's the most dangerous time. Of course, during this time, the mother does not appear to have a big belly or big abdomen. That's why I'm stressing for you to ask the mother or the female patient if she is pregnant or not. Of course, you cannot see from outside, so you must ask your female patient, are you pregnant or not? If you prescribe a teratogenic drug during this time, she will definitely get a diseased baby with major morphologic abnormalities. Morphologic means it can be seen on the body. So sometimes they have cleft palate, they have abnormal hand, they have abnormal legs, they have abnormal face. These are major morphologic abnormalities. So, as a pharmacist, we should not only identify the teratogenic drug as a group of drugs, but we classify the teratogenic drugs according to the FDA. We have 5 major categories. Starting from the least dangerous, it's category A. These drugs have been used for adequate studies in humans and demonstrated no risk. It means these drugs have been used in many females, many pregnant females, and they all got healthy babies. So these drugs does not affect the organ formation or the development. But also these drugs are recommended to be given in pregnancy, like vitamin B12 and folic acid, because these natural elements, they had a physiological decrease in the pregnant female, so we should prescribe her iron, folic acid, and vitamins for her healthy growth for herself and the baby. Category B, they are shown to have some adverse effects only in animal studies, but when given to humans, it didn't demonstrate any risk during pregnancy. A famous drug is paracetamol and penicillin. I want to tell you a very famous example, simple example during pregnancy. Females are always used to take painkillers like loxoprofen or something. These drugs are safe in non-pregnant female, but if the female becomes pregnant, she can only take paracetamol as a painkiller. That's why I always tell you, please ask your female patient if she is pregnant or not. If she is usually taking loxoprofen, you have always to ask her, did you get pregnant or not? Because we will change the drug to paracetamol, which is the only safe painkiller during pregnancy. The same for penicillin. Penicillin is the safest antibiotic that can be taken in pregnant female. Category C, the animal studies indicated adverse effects, but still no data for human studies. It means it has not been tested yet in humans. So we don't know what is the actual effect of this drug in a pregnant female. So these drugs are taken according to what is called risk-benefit ratio. It means we have to discuss with the medical doctor, is it truly beneficial to give this drug to the patient in this time? This drug is very important for her to continue her life, If this drug is not very important, then we ask the patient to not to take this drug, and sorry, you have to continue this illness until you are cured without any medicines. So this is the risk-benefit ratio. So if this mother truly doesn't need this drug 100% for her life, we should avoid, because no enough data is present for these drugs to prescribe in a pregnant female. Example like aspirin, corticosteroids, and gentamicin, which is a kind of antibiotics. Category 5, there is evidence of human fatal risk. It means if the mother takes this drug, her baby will have side effects. One of the very famous examples is aminoglycosides. It's a group of antibiotics, and it causes ototoxicity and nephrotoxicity for the baby. Ototoxicity means abnormalities in the ear and the hearing. Nephrotoxicity, it means abnormalities in the kidney, in your urinary system. Category X, as you see, we have A, B, C, D, and X. X means 100% don't give to the pregnant mother whatsoever. Confirmed adverse effects in animals and humans. Risks greatly exceeds benefit. I mean, if we give this mother that drug, truly, she will get side effects and maybe she loses her life. Example, of course, like anti-cancer drugs. We have never heard about a female pregnant taking anti-cancer drugs, even if she is pregnant. So again, I want you to remember that from the 2nd to 8 weeks of gestation, it's the most dangerous time to give a teratogenic drug, because that baby will have abnormalities. What is the mechanism of teratogenicity? How these drugs just make major deformities and abnormalities in the baby? Just for your interest to know, they cause genetic interference, they change the genes, they cause genetic mutations, they make abnormal genes. There is a chromosomal breakage. As you know, the 46 chromosomes, they can break down these chromosomes. Interference with cellular function, the cells cannot perform its normal function. They cause enzyme inhibition, they cannot make their function, and altered membrane characteristics, so the cell membrane is defective and many structures can enter or leave the cell with no control. So what is the end result? There is a failure of cell-cell interaction between the cells inside the organ or tissue, interference with cell migration during the organogenesis and development, or mechanical cellular disruption. It means the cells burst and die. I want you to show you this picture. I know it's like hard or sad picture, but that was a very, very famous situation that happened with the drug called thalidomide. Thalidomide in the 1960s, I think, it was prescribed and approved as an anxiolytic. It means it makes you sleep well and decrease your level of stress. But it was not checked during pregnancy, or it was claimed it's safe during pregnancy. Many pregnant females started to take these drugs, and what happened? It was a disaster. All the females taking this drug, they had babies with a condition called phocomelia. Phocomelia, phoco means false or abnormal. Melia means the extremities, the hands and legs. All the babies, as you see, they were born with a major morphologic abnormality. They didn't develop their hands or arms or their legs. And a whole generation had that situation. Of course, after discovering that this drug causes phocomelia, it was withdrawn from the market totally. And only recently, it has been introduced again as an anti-cancer drug. So please always remember this picture and don't be shy to ask your female patient, is she pregnant or not? So, what are the guidelines? Finally, to summarize, the guidelines for prescribing in pregnancy. Drug use is generally contraindicated. It means it's better not to give the female patient any drug. This is the major rule. If this drug is not essential for her life, please avoid using the drug. Only few drugs are considered safe, as we mentioned, like the folic acid, the vitamin B12, the paracetamol, and the penicillins. Don't use drugs unless it is absolute necessary. It means it affects the life of the mother. If this drug is not important for continuing her life, please don't prescribe. Prescribing in pregnancy is a balance between the risk of the adverse drug effects on the fetus and the risk of leaving the maternal disease untreated. As I explained, it's according to the risk-benefit ratio. If this drug is essential for the female life, okay, we should give her the drug and monitor her baby. But if this drug is not important, please avoid. Remember that the fetus is the most sensitive in the first trimester. Again, between the 2nd and 8th weeks of gestation or pregnancy, this is the most dangerous time. Use the tried and tested drugs whenever possible in preference to new agents. We have a golden rule as a pharmacist. All the drugs that have been used for more than 40 or 50 years are more safe than new drugs that have been tested for only 5 years in population. Because these old drugs, we almost know all the possible side effects that happened. So if they don't have any teratogenic effects, then all the drugs are always safer than new drugs. Use the lower than usual doses for short period of time. If we have to give the drug, so please choose the smallest effective dose for the shortest period of time. Rule out possibility of pregnancy in every female of the reproductive age group and restrict drug usage. Again, as I said to you, please ask your female patient whether she is pregnant or expecting pregnancy or not. Many pregnant or lactating women take drugs for acute or chronic conditions. That's normal. Some people, for example, a lady, she has a diabetes and she's taking oral anti-diabetic drugs. But if she gets pregnant, these drugs are teratogenic. She cannot continue oral anti-diabetic drugs. She must shift it to insulin. So as a following up for drug prescription, you always have to ask your female patient whether she is pregnant or not. Warn the patient about the risks of smoking, alcohol, and over-the-counter drugs and drugs of abuse. Please don't smoke. Please don't drink alcohol. Please avoid the over-the-counter drugs because they are not safe during pregnancy. So always advise and read the prescription of the drug, read the label to understand whether this drug is dangerous in pregnancy or not. And now, thank you so much for listening to my lecture, and I hope you enjoyed it. Thank you.